and welcome everyone to Women's Health Tech Wednesdays. My name is Nina Joshi, and with me today I have Deb Smolensky. Before we jump in, wanted to give a quick background on myself. I am a consultant and design researcher at Kaiser Permanente's Health Innovation Shop, where I design and deploy digital health products and solutions. And it is my privilege to introduce Deb Smolensky, who is the Senior Vice President of NFP and NFP Ventures. Deb, thank you so much for being on today.
Thanks for having me. I'm so excited for this conversation.
Me too. All right. Well, to start off and kind of jump in, can you please tell our audience a little bit more about yourself and kind of the journey that led you to your role at NFP and NFP Ventures?
Yeah, sure. So I've been in the employer benefits space for about 25 years. My education's in accounting, and I was an accountant for 5 years and got quickly snatched up by a benefits consulting firm through like the 401k avenue. However, they quickly knew that I really like to talk to people and related to health. And so they moved me over to this thing called health and employee benefits way back when. And so I've really worked with Fortune 500 companies and now mid-size employers for my last 15 years at NFP, just really helping HR and organizations design the best employee benefit solutions for their organization and most importantly, their employees. So, that was kind of my overview, but if anybody's taken like the Gallup strengths or really kind of know yourself, I'm a futurist. That's my number one Gallup strength. And so NFP 3 years ago launched an innovation lab and a venture fund. And in my space, right, that's the biggest explosion of technology. So I found out I was really running a lab all this time, like finding new things, creating new things. But I officially joined that team as well as I lead our ongoing health and wellness practice at NFP for our 50,000 corporate clients.
Wow, that's incredible. And so starting with, I know you have a very unique role kind of sitting on the NFP operations side as well as that, future thinking NFP Ventures side. But maybe we can start first with kind of the traditional NFP. Would love to learn a little bit more about the organization's mission and vision, and kind of some of the focus areas for NFP.
Yeah, no, thank you. You said it better than I could. The traditional and the startup, because I have a hard time telling which. But from a traditional perspective, we're grounded as one of the leading insurance brokerage and consulting firms, where our mission is really to help organizations and their employees tackle the most complex challenges related to employee benefits, retention, talent, and just living well. So our real main focus is innovation through a people first lens, so that we're always having those conversations with our clients internally and with our partners and the startup community. So that's kind of the traditional side and our mission overall.
Wonderful. Speaking a little bit more on kind of the, employee benefits and overall employee well-being, really kind of wanted to pick your brain on this. I know that with, the pandemic, we've really seen how it has caused or even exacerbated, existing financial instability for women. So really kind of wanted to get your take on what are some of the things that NFP is doing to kind of, improve employee well-being when it comes to financial wellness.
Yeah. Well, that's a loaded question. So in particular, like financial wellness, it's all woven in together, right? So if you start at kind of our mission around a person, their individual basis, we're really trying to help cover those 5 or 6 buckets of well-being, right? So we're helping organizations check the box on physical well-being, mental and emotional included, social well-being, which is a big thing, community well-being, career well-being, and financial well-being. And so, for women specifically, all of those buckets are so empty right now for us that we really need to fill. And the interesting thing for financial wellness, and women, and for actually health too, we know this, is it's really designed for males to kind of digest in a way, right? And so for financial wellness specifically, we're always trying to look at, from a traditional side, how to deliver that content, how to make sure that content is relevant, the way we digest and utilize financial terms, literacy, education, and obviously money and power in that money in terms of spending. So it comes with picking the right programs, but more nuancing each one of those to make sure that we're talking the way we as women need to understand the way we use money, relate to money, and actually a broader, like, how do we relate to abundance when it's been so scarcity and we're in such a fear-based world right now?
Yeah, absolutely. That's incredible. And you also kind of touched upon another key component, and I think also another area that has been heavily impacted this past year, which is mental health. We, historically, I think that's definitely something that we're all collectively feeling. But I also know that, we've seen studies where women are disproportionately, the caregivers in this situation. So they're feeling that additional burden. Would kind of love to learn a little bit more about NFP and kind of the role that, you are all playing in improving collective mental well-being.
Yeah, that is one of my favorite questions and one of my biggest passions. So thank you for that. I've put a stake in the ground this year that NFP, and we all have, we're really all in for mental health. And what we're doing is expanding that definition into mental well-being and making the distinction. And that's really going to be our platform for the next 2 years. Because what we're finding is there's never been a time collectively where we've all gone through something together like this. And mental health was first recognized in the employer market through the opioid side of things. But unless you went through it with a family member or yourself, you still didn't get what that meant.
Yeah.
And now what I say is, I hope all of us stayed healthy through this, but some might have gotten COVID, but we all had the mental health symptoms of COVID. We've all experienced that. And so first and foremost, what we're really trying to do is harness all of the tools, techniques, and solutions out there to bring forward choice to an employer so that everyone has access, has quality access in a timely manner, at an affordable price, right? So mental health, based on how the solutions are structured, are around clinical.
Right.
And that clinical really only at any given time really is beneficial for 20 to 30% of an employee population. So you start there, don't get me wrong, like every employer, we're saying up your game, go from a regular, like that kind of thing, EAP to a more robust. But we're really then saying, make sure, the virtual visits, make sure everybody has internet connections, make sure you can waive copays or design them. I'm like, Kaiser knows this, all too well, right? You guys are doing great work there. And then what we're really experiencing, 100% of all employees are experiencing, is the daily mental well-being struggles. So I always say, like, if I have a flat tire today, I can't just call an EAP and learn how to handle it. If I get a million emails and I'm stressed and I'm really snippy responding back and my shoulders are tight and my physiology is off, like that is a mental well-being play. And the only way we can all upgrade is through skill-based training. So those are that's a long answer.
No, it's a great answer.
That's where we're headed, is really to open up the mental well-being space after the mental health has been really, check the box for employers.
Right. And I just love the distinction that you're making between mental health and just overall mental well-being, because I feel like, that word and just kind of opening it up can really, I feel like it's just so much more accessible, because I definitely can experience, and just being with family, friends, everyone, we're all kind of collectively talking about it, where sometimes we're all kind of going through this mental burden, but sometimes we don't always classify it or feel like justified as classifying it as mental health.
Yeah.
So I just want to say, I really love that you're making that distinction.
And I love, let's punctuate the word accessibility. Like that's what it is. It's expanding that. I mean, just like on the spectrum for physical health, right? We start with preventive and we go all the way to disease states. we don't have that mental model for, so we start with mental well-being and we go to the disease states, and we need to have solutions through technology, through, virtual care, along all that spectrum.
Absolutely. Yeah. Redesigning the mental health, mental well-being spectrum. I think that is very important.
Yeah.
Absolutely. And then also, wanted to talk a little bit more, I think, when we really think about employee benefits and really what the future of work could look like. I know we're kind of in really interesting, I think, especially 2021, we're kind of in this bizarre gray area as a lot of companies are defining what does the future of work look like, whether that is fully virtual, this hybrid model, et cetera. So really curious on kind of your take and some of the areas of opportunities that you're kind of seeing as we kind of redefine what work even looks like.
Yeah, that's great. You know what I've learned through this? Again, you'll hear me go back to the brain and mental well-being, because this is a skill set thing we all need to learn. But we really most of us look at time as just a straight line, and we just keep marching and marching and marching. But really, what our lives are comprised of are transitions. And the first thing we need to do as organizations and as individuals is tell our brain we are no longer in a pandemic. And an emergency response part of our pandemic. And what did we lose? What do we need to grieve? And what do we want for our next phase? Like, this is a time to get back to dreaming, hope, and really recreating, not only for us, but for our organization. So I take your question and I just say, what is the next 6 months look like for an organization? They need to really go back to their mission statements for the first time ever, their values for the first time ever, because every single one of their employees is not the same as in 2019. Yeah. They have a whole new workforce. Managers need to connect differently. We all show up differently, and so does our organizational culture. So this first 6 months is all about really making sure you identify where you want to head as a person and organization, what gaps are there, what programs and solutions need to fill those gaps, and how to communicate what you do have and where you're headed, so that your brain can start this new transition, right, in this new phase. And so I'm finding that if you're not kind of punctuating that beginning of this new phase and saying, we're going to go back 2 to 3 days a week. Like, flexibility is really important, and leader relationships are really important, and not falling back into the trap of, oh, we used to do it that way, because there's nothing that you can do again the same. Those are all very broad strokes, but that's what we're talking to employers about right now for this next 3 to 6 months.
Yeah, no, I love that period of reflection, almost kind of commemorating or, like acknowledging the past, but also celebrating what the future could look like.
Yes.
Very key, important steps for an organization. And then would love now to kind of pivot more towards the NFP venture kind of side of your role. We talked about a couple of opportunities, whether that is financial wellness, mental wellness, and kind of what that adaptability can look like. Would love to learn a little bit more about, are there any investments that NFP Ventures has kind of worked on with innovative technologies to kind of help aid some of those goals kind of collectively?
Yeah, so our thesis are completely aligned to accelerating key initiatives so that organizations can be stronger and people can be stronger. So our thesis is our insurtech, fintech, and digital health, broad-based. And so, to your point, we're always looking at what can we not only accelerate from an industry perspective, but what can we distribute, right? So it has to match our capability. And then once we find that match, we use our human capital and financial capital to do that acceleration. So right now, obviously, as we shift gears, we're looking from just in the kind of women's health tech realm in that space, key categories that are disruptors that we can see going on, or in from the fintech space, kind of these digital banks, this digital kind of currency and generational wealth delivered in a different way. So my brain goes like this. Those are two very different topics, which I love. that all come back to the individual at the employer, right? It needs to be an employer solution, and not all business can be converted that way.
Right.
So we're really still looking at kind of the family planning space, the caregiving space. We invested in, Kindbody as our first attempt to really kind of, move forward fertility in and care, right? Care and cost control. So everything we do also has to have a cost control component, because that's the number one question we get from employers is, how is this going to reduce my costs? And how's this going to help our employees? But we need to be really cognizant of that. I've learned. So, fertility, family planning, love that. Love all the, startups I've talked through HIT Labs from, because it was huge the last round you guys did in that space. We're also, looking at the whole life cycle. So menopause, how do we help elder care? The caregiving space, is interesting, but it's not too disruptive. So unless it's a new category, we really don't kind of delve deep. Let me stop there. Sorry, I kind of ran. That's what happens every day. Like which side of my brain is on?
No, not at all.
Fascinating.
It really is. And I think what you talked about when it comes to family planning is, I think, so interesting because, I'm definitely a podcast head, and I was listening to a podcast about declining birth rates, right, in the States, and how, from a government perspective, but I would also kind of imagine an employer perspective, how there's kind of a rededication to things like fertility, family planning, et cetera. So kind of really interesting that you're bringing that up as well.
Yeah, there's just tons there, right? I think, to that point, I would love to just make, I would love to just kind of, this is good, we're recording this, but like make vagina like a word you can say in the workplace, right?
Yeah.
Like we have different parts, for the love of God. Like, let's just, and so, talking to venture people, I've had to kind of go downstream, but there are specific women's needs, and nothing's built for us, in the past. So I'm just really encouraging everybody to just keep knocking it out of the park for women. Like, that's my favorite thing to talk about.
Oh, I absolutely love that. That's amazing. And then when we kind of talk a little bit more about, NFP Ventures and kind of some of the parameters, I know you kind of talked about a few key areas that you're interested in, insurance tech, fintech, and digital health. But also kind of would love to learn about some maybe other parameters that you have when it comes to investing in startups. Do you have specific goals regarding health outcomes that you use as kind of a barometer, or any other metrics that you use?
Yeah, I mean, here's the really awesome part of my job is I can throw away every KPI or every revenue and investment measure. That's what my team is super great at. Like, we are stellar. But what I can do is, like, from an investment perspective, they're looking really at leadership, right? What's your track record for leadership? They're looking at that disruptive category. We typically don't lead, but I think things are changing. So stay tuned to that. And we usually do like Series or C to Series B, and I think that will change too, right? This is just a 3-year-old fund that we just started, and we're just going to keep going based on all of our great results. So, but what happens in the pipeline, is it might not be perfect for investing, right? It might not be that 10x return or that financial lens, but I can guarantee if I like a product, I'm throwing it over the wall to the traditional NFP. And I'm talking to some of our progressive clients, and I'm like, you just need to try it. I mean, that's kind of just as hard of sell as to get clients to go from this, oh, I don't want to make any waves with our employee base and try something new, to like, let's just try it and make sure there's some, guardrails around it. So I flip-flop from investment to, to ongoing to investment every day. And I love that part of it. So I really don't have measures other than, let's just make sure the product works. Let's make sure you have really good leadership. Let's make sure there's marketing around it for the employer, and you really know the audience. Like, so size of company really matters for us. Like 100 lives to 10,000 lives is a really different market. Know your lane really well, and that really helps the conversation go.
Love that. Yeah, when you were talking about, from an employer perspective, making waves, it just was so funny to me because we definitely see that a lot. And I feel like calling something a pilot can definitely go a long way to help assuage some of that, feeling of nervousness.
Yes.
So 100% get it. And then also, because you have such a unique role as kind of sitting, kind of like you mentioned earlier, on the NFP Venture House, as well as the NFP, traditional house. Yeah. And so since you kind of operate in this really unique position and have a very unique lens, would really love to learn from you, because you sit in both places, what are some of the steps that you see that need to be taken to really invest and advance, women's health and overall well-being? What does that kind of look like for you?
Yeah, that's a really good question. So understanding the buyer is really key, and how they get their information. So employers get their information through the claims that they're using. And so if your category isn't a top 10 category, meaning it doesn't show up as a problem, they're not going to spend their small $2.25 PEPM on an issue. That's kind of the health category. And that's what we're finding with some of these disrupting categories. Like, it's taken diabetes forever to get through. We have a digestive, and nobody knows really the true cost and true pain points of digestive because it's not an ICD-9 code. And it makes it really hard. So when you want to go for that employer space, either partner with some bigger, broader, so like, hormonal, for example, if you're doing hormonal testing, thank you, God, because it's so needed. But I can't just go sell that because that costs money and it's not a diagnosis code and they really don't know how much it messes with us daily. Right. So we need to wrap it in. So really think strategically about how employers spend their money. What are their targets? And their targets are only the pain points they can see, hear, or feel through their pocketbook or through employees asking for it. Yeah. Is there another part to that question? I got off my tangent on that one. Well, you were asking about just like what else should they consider. So, I mean, after you consider where your product fits and if it's right for the employer market, right? And it can be rolled up and measured. Then you need to see like how much you can take over and disrupt that pain point versus just a sliver. So if you are only working with, let's just say women let's just say you're a mental health provider for postpartum only. You're not going to spend the money, even though that's needed, right? And it might not be specialized in these broader mental health categories. Employers aren't going to spend their $2.25 budget on just that sliver. You need to, again, expand it into a very robust offering like these polychronic partnering. And I know it's really hard when you love your own specialty and category, that's your baby. But I think the more you can partner and pull together solutions is going to be the wave of the future for everybody to make money, make a difference, and stay around. Absolutely.
And then, I 100% I think makes a lot of sense. And you kind of also touched on something that I'm very curious about too, when we kind of think about how as a startup or as an innovator really needing to think strategically and kind of thinking about what that looks like long term. Would also love to learn, from your perspective, have there been any changes either from an employee prioritization or even from a venture prioritization kind of in a post-COVID-19 world? Have you seen, shifts from a strategic perspective that innovators or startups should know about?
Well, I mean, from a venture, just quickly from a venture, we pivoted really quick just to scan the market for COVID delivery,
Mm,
right? I think we figured it out and it's being distributed, but those are the kinds of shifts that we weren't used to. But when it comes to health, that's what we'll be looking for. So, we don't know what to expect, but things are going to come out of the woodwork for people not going through into healthcare. And so, that virtual visit, that collective, that kind of thing, I think is going to be really important. For NFP, we're going to spend a lot of time on mental well-being. We're back in the 80s as in terms of like physical health and getting employers to take ownership of getting their employees to be healthy. We started with seatbelt credits, smoking sensations. Like now we're at, you need to put these skills in place. We need to practice awareness training.
yeah.
We need some support for parents. I think it's around like upskilling in our personal development and how we handle life and how we do work life integration. I think it's going to expand into helping managers put some emotional intelligence in.
Mm,
I think there's going to be a lot of AI on how we can do some more benefit scraping so that when I have a point of contention, it automatically feeds me the right benefit because nobody's using their benefits.
yeah.
And then, from a financial perspective, it's like, I think it's going to be the first dollar spent. How do you take that paycheck, pay off all the bills that person is struggling with, balance buying the right insurance, and then saving the right amount, and then investing all at once? Like that kind of technology and kind of navigation is going to move over to the financial well-being space, I think.
Yeah, yeah, absolutely. And I think you talked about really this important integration between work and life. And I think that's definitely something that has been blurred for quite some time. So really excited to kind of see how it will kind of slowly start to parse out and kind of, but still also work kind of in sync with each other. I think that harmony is going to be really important moving
Yeah.
forward. Fingers
Yeah.
crossed on that.
Yes.
And then, really quickly wanted to ask, I know we're kind of towards the end of our time together, but really kind of wanted to ask you about, I feel like health accessibility, especially for women, I think is something that is really important, within this employer realm. Would love to learn about, are there any specific, key initiatives or projects that you are working on to kind of improve healthcare accessibility or even, mental well-being accessibility?
Yeah, thank you. Because I mean, as I'm 10 degrees disconnected from the accessibility entry point, virtual care was really interesting. So I think accessibility in telemedicine for women's specific issues is going to be really helpful. So the more I've gleaned to menopause telemedicine, I love that. It's saved me. Like the more you can get to the life cycle of what we're at in a virtual way, that's really going to be it with key practitioners and key knowledge bases. For the mental well-being, and this is not women exclusive, I do think, well, first of all, I would love to solve every woman's cancer there is. Like, let's just say that out there. Because every health initiative is based on a male body, right? Male physiology. And that drives me nuts. So when you talk about accessibility, I think it's let's make the solutions work first of all for our body.
That's step one.
Yeah, let's go there. And then besides that, realizing for mental health, and mental well-being, we like to talk to practitioners that know and understand us. So having cultural competencies and representation in every venue that we access healthcare and especially mental well-being would be important.
Absolutely. I think 100% agree. And I feel like that's just a great way to end our discussion, just accessibility and empowerment for all, but especially for women. Okay. Awesome. Well, thank you so much, Deb. It was such an enlightening conversation. Just wanted to quickly highlight some upcoming events at HIT Lab, so be sure to check those out. We have our Innovators Showcase tomorrow, and then next week we have our Women's Health Tech Wednesdays. And be sure to follow us on social media for all of the latest updates. And then also really wanted to thank you again, Deb, for such an amazing conversation. I personally learned so much, so really, really appreciate it.
Thank you. It was great. And come to LinkedIn and find me if I can help.
Wonderful. And also wanted to thank our sponsor, Goodwin, for sponsoring Women's Health Tech Wednesdays, and of course, all of the amazing discussions that we get to have. Thank you again, everyone, and see you next week.
Keep doing the great work. Thank you.
Bye, everyone.
Bye.